just introduce to you a bit about Whittington Health, what we are and what our strategic objectives are. And then Sam will show you a film and talk a bit about one of our services that represents one of our strategic objectives, and Delia, another one. So I'll do the easy bits. So Whittington Health, we became, we are actually Whittington Hospital NHS Trust. We are applying to become a foundation trust, which we aim to be by the end of next year. We're being assessed to this at the moment by, it's like being back in school and doing your GCSEs. We are on track, but at the moment that's how we operate. But the name we've chosen for ourselves in the meantime is Whittington Health. We became into operation in 2011, and basically it's the result of these 5 bubbles. So the Whittington Hospital has acute services, Haringey adult service came from the Islington from Haringey PCT. Children's services came from Gosh a bit later, end of May 2011, from Great Ormond Street. We had Islington Adult and Children's Service from Islington PCT, and adult and children, some aspects of children's social care from Islington, from London Borough of Islington. So you can imagine we've only been going for about 18 months. It's a big ask to actually get 5 organizations coming together into one. Huge difference in cultures. If you think there's a culture difference between the council and health, I can tell you how different it is actually within health between community and the hospital. So we have come together. We've stormed and conformed a bit, are still doing that. We obviously had to set our strategy for the next 5 years. We've just revised that strategy and it's going to the board tomorrow, so you'll be able to see it after tomorrow. I'm not going to go through all of these, but what I really want to highlight is that we are very keen in working in partnership. We cannot deliver both the quality and the level of actually efficiency, cost savings we have to deliver in the next 5 years, which are extremely challenging alone. So we've always believed that in Islington, as you know, but we are now dependent on that. So not only believe, but dependent. So the partnership with the general practice, with councils and local providers, because for acute, it's very important to actually have clinical partnerships with other hospitals. We have partnerships with the mental health trusts. So it's vital for our survival. We have 5 key strategic objectives. Integrated models of care is our #1 objective. After all, we are an integrated care organization with integrated care models. Delia will talk more about this through a specific case. No decision about me without me. We've actually changed these because of the sentence in our new strategy, but it's basically about the same. And Sam will present these objectives. Obviously, we have to deliver efficient and effective services. I just want to tell you on these that the Whittington Hospital is the safest hospital in this country. 2 years in a row. We have the lowest mortality rates in the whole of the UK. So I thought you'd be pleased to know our local hospital. We're very proud of it. We don't do everything right, but it's pretty good. So we certainly deliver quality. In terms of efficiency, we're not efficient at everything we do, but we're working really hard to get there, particularly through partnership. We also, an organization, very clear that we're not just about healthcare, we also improve the health of the local population. For example, the work we do in Pentonville Prison, which we have a contract of about £6 to £7 million to provide health services there. Most of the work we do as Whittington Health, we subcontract the mental health service, are all about health promotion. We run well-manned clinics, it's huge, big primary care actually center there. That's what we actually do, as an example. And then last but not least, we can't do any of these without our staff. So I will now pass you on to Sam. I'll talk to you about the family nurse partnership, one of our services to identify the insurer. No decision about me without me.
Hi, afternoon. I'm just going to introduce a film that we made about the Family Nurse Partnership Programme that we deliver here in Islington. Some of you will be very familiar with it, others may not be so. We made this film to demonstrate, to articulate our strategic objective about no decision about me without me, but it actually fulfills many of our objectives, not least our commitment to prevention and early intervention, which is an objective that we share with the local authority. And this is a key innovation, evidence-based, targeted approach that we use, that we share with you, very much so. It's something that we all feel we have some ownership of, and we're really delighted to do that. Our programme is going extremely well, and what we're doing now is working with our partners in the local authority and our children's centres to say, what can we learn about this and how do we support this to change the way that we work with families across the board. So we should have a film coming up straight away, and this will tell you everything you need to know about the programme.
FNP kind of gave me a better experience of being pregnant.
They've helped me through my pregnancy stage and helped my child grow as well.
Half of the things that we've gone through, I don't think that me and her dad would have just gone through it alone.
I like the friendly service, that they actually listen to you.
I just enjoy having support and having someone to talk to.
They're there and they don't judge me on my age.
And it also helped me to look after myself, look after my baby.
Me and my daughter's dad, we was in quite a violent relationship and it was really controlled, and I was taking a lot of drugs at the time, but they came into my life when I was pregnant and I stopped taking drugs. I got out of that relationship.
I wouldn't like to think how bad things could have been without FNP.
The Family Nurse Partnership Programme is a licensed programme with over 30 years of rigorous research that has shown significant benefits for young families. It is a preventative programme for first-time teenage parents offering intensive and structured home visiting, delivered by specially trained nurses from early pregnancy until the child is 2.
Shocked. I was excited.
It was unexpected.
I was scared, I was sad, I was emotional.
It was just me and my daughter's dad.
I had my family.
My mum, because I rang her as soon as the first test was positive.
Lo and behold, my nurse Jane came along when I was 3 months pregnant.
Yeah. At first, I thought it would be like intimidating. I was thinking, oh, who's these people? Are they going to come and like investigate on me?
I was quite sceptical. I'm not really a government fan of anything, of any services, never had a good experience.
I thought Lorna was going to be this nosy person who would rather point out my bad things I was doing with Casey than rather the good points.
She don't put down my confidence, she just cheers me up and makes sure I do everything as I'm supposed to be doing.
The whole programme and the way we work is giving young people a lot of respect.
We hope to actually build on all their strengths, so we're always making sure it's a strength-based programme.
We often want to fix it, but we can't fix everything, but we can listen.
To support, parents to see what they're doing right within themselves and make those changes where necessary on their own.
It was different because FNP never made me feel like a statistical young mum. I was a mum in my own right.
And I thought, no, they're not like this, they're just trying to help me as a person.
Other organisations that I worked with in the past, I find that they're just trying to tell me what to do. Whereas Celia, she takes the time to listen.
When my boyfriend, her dad met her, he was like, yeah, I really like her. Anything that we don't know, we'll just phone and ask her.
It gave me so much information on what to expect, how my baby was growing, what to eat.
She showed me how to kind of feed the baby and how to change a nappy.
Like, she's giving me kits to make sure I've covered my socket plugs.
Getting all of her things, what she needed, what she didn't need.
I worked as a health visitor previously, so some of those skills I could incorporate, but the difference is in this, because it's such an intense role, that you have a lot of supervision.
There's always ongoing supervision and time for reflection. And time for looking at how you can move on yourself with a client.
This is a home visiting programme, and you spend a lot more time and you know the clients very well.
They're able to build a rapport with that one nurse that they see consistently through the programme and get the support there, where they're then able to share things that ordinarily perhaps they may keep to themselves because they haven't got that trust.
Probably you need quite a lot of determination, a bit of resilience.
You've got to be passionate and very caring.
You've got to have a sense of humour. You've got to be pretty broad-minded.
They really encouraged me to be the person I am today.
I wasn't happy with education. I wanted to take a year out.
I failed all my GCSEs, so when I was pregnant I took courses in first aid, I took a parenting course, I took a literacy and maths course.
We look at where the client is and what's actually happening for that client at a time.
Now I'm in university.
It's helped me cut down smoking. It's helped me think about nursery for Taylor.
It's given me a lot to think about, like, what am I going to do? Am I going to go to work or am I going to go back to college?
One of our kind of key outcomes when we're working with young parents is to kind of build their confidence and facilitate them being able to access services.
My nurses helped me get Casey into a nursery place, and so I can go on college courses.
We are keen to get them engaged with community services, so we've got that ongoing support once we do step out, and in doing that we'll accompany them to kind of pre-placement tours of the nursery.
I thank her so much for supporting me as a person.
She was like a prominent figure for me as I had no one else.
I'm glad that they're in my life.
It's quite hard to quantify to other people just what that means to have someone permanently in your life for 2 years.
You really are kind of like welcomed in by the whole family.
I was quite sad when my time with FMP finished. I was quite emotional to say goodbye to Jane. But I was also quite grateful to where it had got me.
You'll build this confidence where you think, yeah, I am a mum, I can do this, and it makes you more independent.
So one of the parts that I really enjoy about my role is the process of seeing mums develop, really, and sometimes dads.
Being able to see, you know, parents grow up and their children grow up.
Anything that I wanted to do, she would help to encourage me to do it.
And after this, I still want to go on and on and on. I'm not stopping.
To give it a go. You never know what's going to happen unless you try something.
For those of you who aren't familiar, intermediate care is services which have a fairly short-term intervention and which are aimed at predominantly older people, but either avoiding admission to hospital or to help people get home again and to be as independent as possible, avoiding the need for long-term care. And they're often triggered by hospital admission or someone having an illness or deteriorating. And I guess just to say, one of the reasons why it's so important is that we know that older people tend to often deteriorate rather than get better when they go into hospital. So if we can keep people, and then they have a longer journey to get back to independence. So we're trying to keep people in their own home as much as possible and support them there to keep as well, and healthy as they can. So in Islington, we have a range of intermediate care services, the reablement service, which some of you might know of, and added into that now enhanced reablement, which particularly works with people with more complex needs, including dementia. We have community therapists, OTs, physios, speech language therapists. Recently, a pharmacist has joined the service, which is great because a lot of people get very muddled about the medication, and that's another reason why people end up becoming ill or needing to go to hospital. And obviously social workers are actually in all of those teams, and in the hospital teams, both Whittington and UCLH are two main hospitals. Oh, sorry, not working. So, okay, got it. A lot of links with other services. Really important to take a very holistic approach to what people's needs are and be planning for what their longer term needs are and how we meet those. And particularly for older people, we know that the more people stay integrated with their community and have social networks, the better they do really as they age. Just listed a few of those there. Particularly, I think worth mentioning the voluntary sector, and both Age UK and Carers UK actually come into the Whittington Hospital and offer meetings with clients or families and advice to staff there. So how have we integrated care? One of the things I really want to mention is the daily Data Friday teleconference, which we do between hospital community teams, not just the Whittington, but UCLH and other hospitals if necessary. And that is where everybody comes on the phone call at the same time, the key decision makers. So you very quickly in real time, rather than waiting for responses to emails and reports and things, actually make decisions about what's the best pathway for people, allocate actions, who's going to do what. And really it has helped so much in terms of discharging people and helping them get out of hospital as quickly as possible. Estimate of about 300,000 a year saved just by paying for a teleconference and having people committed to that. The discharge team in the Whittington Hospital is now fully integrated, and that means that the nurses and the admin team from within the hospital, as well as the social workers, are all based together, share offices, and again it's a real opportunity to communicate a lot better than we would have done. We've been doing quite a lot of work around in-reach from the community services into the hospital, and also hospital teams, for example, something called FEDS, which is not a great name, but it's the Facilitated Early Discharge Team. They follow people out of the community and make sure they're settled, and also beginning to do the assessments and pass them on to the community teams like reablement. And reablement similarly have staff who are coming into the hospital, and again it's really cutting down on some of that duplication and making it a much more seamless process for people. Reducing the paperwork for referrals, that referral ping pong when someone makes a referral to another service and it hasn't quite got the information that people want and goes back and forth, trying to cut that out by having teams just come in, talk to staff, meet the patient and make a decision there and then. And looking at sharing electronic records, and as much as possible how we move to better sharing of information electronically in terms of shared records as well. Just a couple of case studies that I wanted to talk about. This is one that took quite a long time, a lady who had quite a chaotic lifestyle and was actually refusing services to help her with her problems, which included heavy drinking, very uncontrolled diabetes was leading to lots of hospital admissions. But the community matron managed to make a relationship with her, and through that, coordinating that and linking to the social work teams, community dentists, the support to stop smoking and to help her control her drinking, moved her to actually much more suitable accommodation and to sheltered accommodation. So managing her diet, her diabetes, her lifestyle was very much about helping her to get back and have that control, and very much about her having a sense of control over her well-being and her health. Self-management, as a jargon, but also the really big things that came out of that were that she wasn't having repeat hospital admissions, and also in terms of being able to reunite with her son and meet her grandchildren. So for her, what turned out to be a really positive change in her life. And the second example that I wanted to talk about is an older lady who had presented at hospital more than once, quite malnourished and with a urinary tract infection, could have led to admission because she has dementia and was unwell. But in fact, because we have the enhanced dementia, she was able to go home and have support from the reablement enablers going in, and then a very intensive period of assessment with the community mental health nurse, social work, OT, having a real look at what was happening at home and identifying that actually her husband was struggling to support her, which is what he really wanted to do. So when she said, "I'm not hungry," he didn't actually force the issue, and she was becoming malnourished and ill because she wasn't eating. So from a very intensive period of work and 5 visits a day, that reduced down to 3 days. And the really good thing was that she stayed at home. She and her husband maintained their relationship, which they both really wanted. The family were more involved in meeting her needs. and she didn't have a long hospital admission that could have led to a move to long-term care. And that was really, in a nutshell, what I wanted to say.
Thank you very much.
You've got me again. It's just as a closure. We just wanted to give you an impression, because I always feel people think of health, particularly because we are in an organization with a hospital. We are all about doctors and nurses, because that's how the government portrays health. As you can see, we are not just about doctors and nurses. We also have doctors and nurses. If you looked in 5 years' time to Whittington Health, what we would like and what we're planning and we're working now on to be is a much smaller hospital, very different hospital. If you came into Whittington Hospital, you probably wouldn't pass A&E, ambulatory care, where our consultants will see you, will treat you, send you back home, and then they follow you up at home. And the maximum, if you're really complex, you go to an assessment, acute assessment unit. We will have what we call the end of the hospital, very small, with very small specialist wards, and probably very few or none what called geriatric beds, as we've got now, the care of the elderly ward. So it's very, very, very different model of acute care. We're working very hard. It's a plan that will take us a few years to get there, to actually get there. At the same time, you will see a much more enlarged community services with yourselves, with primary care, to actually look after these people before they are ill. They're ill, and after they become actually out in the community, either going into hospital to this ambulatory care service. So it's very different. We can only do these, we can do this anyway, but it has been speedier probably in terms of achieving the initial stages of these, because we are in this integrated care organization and we firmly believe in working in an integrated manner. So that's very, very important. Even in surgery, where you probably think it's very medical, isn't it? You go, we have all these operations. I just wanted to leave you this example. Since we became an integrated care organization, people with fracture neck of femurs who went into the Whittington, who waited hours on end in A&E, and then they moved to another ward and another ward and another ward, and eventually ended up in a residential home. They stayed in the hospital on average about 23 days. They now stay at Whittington on average of 9 days. We haven't spent any more money, a bit on orthogeriatrician, that's about it. By actually redoing the way we treat these people in hospital, we started even with falls prevention and all of that, but if you do fall and break your hip, and we're aiming to actually reduce it down to 6 days, which I think is very ambitious, but that's what the clinicians and the nurses and the others want to do. So just to show you that even in what looks so much like an acute specialism, by working in an integrated fashion, we can actually save a lot of money and provide a much better quality service to patients. Thank you very much for listening to us.
Thank you.